Alright everyone, we'll talk about a skin case which is Urticaria. So as I told you before, each mind map has three angles we look at. First one, a possible story, how that case can present in real life and what will be the patient concern, for example, in any situation. Second angle is we look at what is written in the NICE guidelines, so you feel confident when you discuss your case. And the third angle is giving you all of that in a single piece of mind map, so you never go wrong and you do not need to struggle with studying. Let's start with angle number one, what that case can come with in real life, for example, or as a sample. That may be a child who is maybe a few years old, and the mother is concerned because her child had a rash for the last few days, and that has happened after a trigger, maybe after having shower or after playing outside, and that rash self-resolved. Okay, so the child is fit and healthy, and then when you ask to examine the child, the mother can give you image of urticaria, and that will be your diagnosis. What the mother can be concerned about, for example, the mother can ask you, is it infectious or contagious? You need to reassure urticaria is not contagious. The mother may be worried if it is meningitis, because someone with rash, everyone in UK may worry about serious infections like meningitis, or maybe the school or nursery is worried if that is meningitis. So reassure, that is the big elephant in the room. In the management, you need to reassure it is not meningitis, because meningitis would come with a different rash and different symptoms. She may ask you, can she go back to school? Of course she can. There is no exclusion for urticaria. That's a possible story as we have seen. Let's see what is written in NICE CKS. So for urticaria, what will be the management of urticaria as per the guidelines? The first part of management is what the patient can do, which is basically making a diary, avoiding the possible triggers, because urticaria is basically a reaction to an allergen. So identify and manage the underlying cause or triggering factor. So advise the parent to do a diary and avoid possible triggers. What will be the second part of management will be the doctor part. What can I offer to help them? You can offer a non-sedating antihistamine to ease the symptoms. That can be bought over the counter, or you can prescribe it. It should be fine, such as cetirizine, for example, or loratadine for up to 6 weeks. If symptoms are severe, the second line for the doctor to offer, but that is only if that one doesn't work, or if it is severe urticaria, we can offer a short course of oral steroids. That is what you need to know from NICE CKS. Apart from that, the mind map will be quite clear. Let's discuss it together. The presenting complaint is rash, so we ask an open question to explore the presenting complaint. Can you tell me more about that rash? So you ask an open question, you listen to the presenting complaint, and then you ask Udibara of presenting complaint. When did that start? How does it look like? Can you describe it to me? Is it getting worse? Is it getting better? Okay, so ask Udibara of the presenting complaint after you listen to the skin symptom. And then you ask about trigger. The second step, as we do in every presenting complaint, was that triggered by anything at all? She may give you a trigger. For example, it happened after eating, so it may be something in the food, or it happened after having showers, so it may be something in the shower like shampoo, conditioner, or maybe the hot water or so. So ask about trigger because it's a relevant information for you to know. And then we ask about other skin symptoms or other symptoms with that problem. I always tell you the third step in presenting complaint is to ask two others, one other for the patient to help you. Mrs. Smith, with that, have you noticed that Amy has been experiencing any other symptoms at all? She may tell you, for example, if there was a fever, there was maybe itchiness, or there were maybe sneezing or any other symptoms. And then you ask other symptoms of the same system, other skin symptoms for you. So is it itchy or not? Have you seen any discharge, any bleeding from anywhere? Is there any rash anywhere else? So that first step, as we do in every single mind map, there is no change, but it would confirm to you one possible diagnosis here. And then the second step, we ask closed-ended questions for red flags and differentials. The red flag, what is the red flag for me? Of course, anaphylaxis is my red flag. If someone coming with rash or urticaria, I may worry about anaphylaxis, so ask closed-ended questions about anaphylaxis. Mrs. Smith, with that, has any experienced any difficulty with breathing at all, any swelling or any rashes near the eyes or near the mouth? So ask about any problem with breathing or swelling in the face, and that will be negative because anaphylaxis is a medical emergency, of course. And then closed-ended questions for differentials. As I told you, any child with rash, you need to make sure to rule out meningitis, and that will be usually the patient concern. You can ask about any spiking temperature. Have you tried to press on the rash? Does it fade away or does it stay the same? Did your child complain of any pain with moving the neck? Is she shy from light? So you can ask about fever or shy from light for meningitis. That will be negative to confirm your possibility of urticaria. And of course, as I told you, viral infection can be a trigger, or viral infection can be actually a differential, because viral rash can look similar to that. So you can ask about, was that how the child has been doing? Does she have any coughing at all, any sneezing, or has she been having any viral symptoms? That would be my 3 lines for closed-ended questions. Do not go more crazy than that. Third step, as we do in every single mind map, is general well-being of the patient or relevant maptosa. Has Amy been diagnosed with any medical problems at all? Does she take any medicines on a regular basis? Why? For example, someone with history of asthma or eczema may be a risk factor. If she's trying a new medicine recently, that may be a risk factor. Is she known to be allergic to anything such as medicines or foods at all? Why? That is a risk factor as well. Then you can ask about family. Anyone in the family has similar rash at all? Because contact dermatitis or contact type of rashes can come in a similar way as well. And then you can ask about, of course, it's a child. So you can ask, how was the birth? Is she up to date with immunizations or not? As simple as that. Do not go crazy about that step as well. And then you can ask I as the mother, what do you think may be causing that rash for your child? Anything specific is worrying you? Yes, doctor, I am worried if it is contagious. I am worried if it is meningitis. So when she is giving you that information, she is helping you to score 12 if you manage these concerns in the management. Of course, you can ask about expectation, as we do every time. Were you hoping for anything specific I can offer you today to help your child? Then she may tell you, doctor, yes, if you refer me or do an allergy test or blah blah blah, that will give you relevant information. Then offer to examine the child. I would like to examine your child. That will include me looking at the rash and taking her temperature and checking her observations as well. You will be given a picture, clear-cut urticaria, as we have seen in the previous slide. Then give your management. Having listened to you, Mrs. Smith, having seen your child rash, I think what she's experiencing is urticaria type of rash. Have you heard about that before? No, doctor. So that's an allergic reaction due to exposure to some allergen or a trigger that she may be allergic to. For us to help you with that, there are a couple of things you can do yourself and a couple of things we can offer to help with that rash. Things you can do, Mrs. Smith. We know that that is a type of reaction to something, so it will be useful if you do a diary for the rash. Whenever it happens, write down how did it start and what the child was doing or what Amy was doing at that time, so we can try to elicit the trigger to avoid that in the future. What we can do, we can give you some antihistamine or some allergy medicine, allergy syrup that you can use whenever it happens, and that would help with the irritation and itchiness with that. Sometimes we may need to give you some topical steroid to help with the redness and itchiness as well. I'm aware you were worried if that is meningitis. Let me reassure you, it's unlikely to be. Meningitis would come with a different type of rash and as well would cause other symptoms such as fever or problem with moving the neck. So I'm happy to reassure you that it is unlikely to be. Doctor, is it contagious? It is not contagious. Doctor, can she go back to school? Yes, she can go back to school. And then safety net about what? About anaphylaxis, the red flag. So if it ever happens again and if it affects her breathing at all, or if the rash happens near the face or near the eyes, please do seek immediate help by calling 999, because there is a rare complication of that called anaphylaxis when that reaction happens near the airways. And I'll print a leaflet for you about that type of reaction or that type of rash. You can read more about it, and if you have any questions you can call us back. We can arrange a follow-up again in the coming 2 months or so to check the diary together in case if we find a possible trigger that we can avoid. As simple as that. As you can see, everyone, the mind map is including everything you need to know from nice CKS. Again, if you like to join our package, it has all cases in a similar mind map with all other things you may need for Plab2. Just to contact me on that number. Apart from that, please look at the mind map again. You should not struggle with that case. It is for 12 out of 12. Thank you.